I don't have a presentation. I was going to share my screen and go through the checklist that I had shared by email. But I think before I do that, I just wanted to give a background on these checklists, so where they came from, because I'm aware that not everyone might know. So to begin with, over the last 2 years, the CEA team we initiated some research to better understand the role of CEA in emergencies and to develop simple and realistic guidance and tools that are tailored to emergency responses and also to different sectors and roles that are involved in emergency responses. So this research was led by the CEA Africa team between 2019 and 2021. And we tried to understand the current practices that national societies and IFRC were doing to integrate CEA into emergencies, what challenges they were faced with, and what were the gaps. And during this research, we had focus group discussions and consultations with 440 community members, staff and volunteers in 3 separate countries, in Sierra Leone, in Uganda and Niger. And then we also held 72 key informant interviews for people in different sectors of an emergency response at the country level, at the regional level, and the global level. And it was this research that helped us inform what were the 10 CEA minimum actions that should be implemented during an emergency response. And these 10 minimum actions are now embedded into the revised CEA guide. So they're available online on the Community Engagement Hub. And I can put a link in the chat soon. I know everyone in the CEA team will know that, but just in case someone from the CASH team wasn't aware of this hub. And then the minimum actions, they're also supported by several tools, most of which, again, are already included in the CEA toolkit, and this is also already online on the Community Engagement Hub. And some of these tools are currently being field tested by Tom, by Lillian, Gabriel and Dauda for the hunger crisis in Nigeria. And they'll talk a little bit about that today as well in the next couple of minutes. So part of these tools, we are developing CEA checklists for sectors and roles, which are currently being developed by my predecessor, Eva Erlach, and myself. And they're being reviewed by the technical sectors. So Maya has very kindly helped us review the CEA and CVA checklist that was shared. And we plan to have a total of 7 checklists that are going to be produced at the moment. Obviously, we have the cash and voucher assistance one. We have the WASH one, which is being reviewed, and health is currently being developed as well. So the CVA checklist is based off the learnings from the COVID-19 CEA for CVA checklist that was developed in 2020 for the pandemic. So you'll see a lot of similarities between the two if you have accessed the COVID-19 version. I'm just going to share my screen now so that you can see the checklist. Hopefully you've already seen it before this call, but if not, don't worry about it. So this checklist goes through all of the different stages of the response cycle, the program cycle, sorry, in an emergency response. And it's split between the minimum measures that should be done to integrate CEA in the emergency response, as well as the advanced measures that should be done to integrate CEA in the emergency response. And what we mean by, yeah.
Maybe zoom in a bit. It's quite small.
Sorry, thank you. Is that better?
Yeah.
Okay. Sorry, I always look at it quite small. So as I was saying, the minimum measures, they apply when the response is quite early on, so the first couple of months of an emergency response. They also apply to the smaller emergencies when there's not that much time, and they'll finish in less than 6 months. Also, when there's a limited HR capacity and experience in community engagement and accountability, either within the National Society or the surge support that comes in, and also when there's limited funds in the response. And then for the advanced measures, we usually consider that later in the response, so 3 months onwards is our guidance. It's also for more larger emergencies that have longer term timescale, so longer than 6 months, and when there's good level of community engagement and accountability, experience and capacity within the National Society or SURGE, and when there's a good level of funding and human resources by then. So as you can see, we've split it across different stages. So at all stages of the response, we have minimum actions, which include briefing staff and volunteers on CEA, for the whole CVA team to be aware of who the community engagement focal point for the operation is. And we've also included in this column why. So the reasons why behind integrating these minimum actions are important. So why do they need to be considered and integrated? And we can see as well in the next columns that you can do a checklist. So you can select whether you've achieved it, whether it's been somewhat achieved, not achieved, and maybe it wasn't applicable to that response, to that context. And a space here for justifying, why you think that this measure was achieved, so what was done, and why it wasn't able to be achieved. So what were some of the challenges, for example, that was faced? So that's for all stages of the response. I won't go through every single one because I think that's going to take quite a bit of time, but we do have other minimum and advanced measures for assessment and the context analysis. So this is the needs assessment phase. We also have minimum and advanced measures for planning and designing of the intervention, as well as implementation and monitoring of CVA modalities, and finally evaluation and learning. So in some of these actions, you can see that in blue, we've added links to existing tools that we have available to help facilitate and implement these actions that we're recommending that they be implemented, most of which have already been created, but there are very few that are still in development. And once we've created them, we'll add in a link into this. But we wanted to share this with you because it's still open for feedback, and I would be keen to get your opinions on, one, the format. Do you think that this is something that's easy to understand, easy to go through? Do you think that it's easy to also use as a checklist? Is there something that's missing that maybe we could add on or change things around? And we also wanted to get a perspective on, how do you find the minimum actions? Do you think that they're feasible to do during an emergency? Do you think that maybe some of the advanced measures that we've added in should actually be considered as minimum, and vice versa? So just, if you have the time just to go through it, a couple of minutes, and provide feedback directly into the document, that would be greatly appreciated. And we'll soon be finalizing this as well, and we can share for use. But I don't know if there's any questions on this checklist.